As the founder and CEO of Change Enthusiasm Global, I have the privilege of creating significant value for our client base at the intersection of change and emotion in the workplace. And given the fallout of the COVID-19 pandemic and the mind-boggling rate of technology integration, the healthcare industry has quickly become one of our most served industries. And in this video, I'm sharing the healthcare trends that I'm seeing personally impact organizational change all around the world within this incredible industry. Trends that not only impact those working in the industry, but also those of us who engage in the services of that industry. Yup, that more than likely means you. Let's get it. By the end of this video, you're going to have awareness of 4 healthcare trends impacting organizational change all around the world: patient and healthcare provider expectations, digital transformation, consolidation, and labor shortages. I'm going to talk through each of these, divulging the impact that I'm seeing in healthcare organizations all around the world. The first trend is patient and care provider expectations. The healthcare industry was absolutely rocked by the pandemic. Healthcare workers, researchers, care providers partnered with local governments to mobilize and immunize the entire world's population in a matter of months, while still striving to provide care for all other COVID-19 unrelated healthcare needs. They had to get nimble. They had to innovate. And the fallout of all of this has been a shift in both patient and care provider expectations. Patients now have this newfound comfort with telehealth and virtual hospitals because of the ease and flexibility that they afford. And providers are doubling down on this because of its cost efficiency. But of course, these types of changes are requiring change within the organizations that's delivering this type of telehealth and virtual hospital care, right? The training looks different. The patient interaction looks different. The follow-up looks different. And of course, there's technology that's been integrated that the care providers and the workers have to train on and understand in order to deliver to their patients, while still conveying the compassion and that empathetic care to their patients that we all still expect. Nonetheless, these are changes that our healthcare organizations are having to embrace in order to remain relevant moving forward. The second trend I'm seeing is digital transformation. As tech innovation continues to boom, the healthcare industry is not immune. There was an article written in Forbes magazine back in 2022, and it was predicting the trends to be expected in healthcare in 2023. It stated that artificial intelligence has already been embedded in the healthcare ecosystem, but 2023 and beyond will see it proliferate, with use cases in higher efficiency drug discovery, medical imaging analysis, to clinical trial outcome predictions. And with these integrations, organizations are having to adapt to get on their learning curves and move through them very quickly as they're integrating this technology, as well as fight against long-standing bureaucracy to actually bring the technology into the organization and allow that use to continue. Yo, you getting value? I drop videos like this all the time on the daily. So make sure you click subscribe so you can be one of the first to get notified when a new video drops. All right, let's get back into it. The third trend is about consolidation. The competitive landscape in the healthcare ecosystem has become fierce, which is leading to heightened merger and acquisition activity. The large, long-standing giants in the industry are being threatened by smaller, more agile companies. Not to mention the introduction of retail health, with players like Walmart and CVS and Amazon disrupting the category. And of course, the major disruption that Mark Cuban and Cost Plus Drugs is having to cost structure transparency. And when the large players can't beat the small players, they're seeking to either merge or acquire. And these dynamics are resulting in significant organizational changes as companies are getting integrated, as executives are striving to nurture more agile cultures that can be very quick to respond to market threat, to competitive threat and to seamlessly integrate these acquisitions. Of course, with little to no interruption to the daily operations of the business or interruption to the innovation pipeline. The fourth and final trend, and perhaps the most significant, are the labor shortages. Burnout is still a major factor in the healthcare industry and amongst healthcare workers, with many of them either exiting the workforce or pursuing different career trajectories. Of course, this was accelerated during the pandemic, but has continued to remain in effect because of the aforementioned trends. Because of the highly competitive landscape, the fallout from the COVID-19 pandemic, and the business imperative for digital transformation, those working within this industry are experiencing levels of change fatigue like no other industry that we're seeing at Change Enthusiasm Global. So speaking about organizational change, especially leading others through that change successfully, I've got something I want to offer you completely for free. It's a recording snippet of a keynote message that I delivered to a client going through significant organizational change and dealing with market volatility. Now, this is the portion of the keynote where I'm sharing insights from our latest research at Change Enthusiasm Global, which is really understanding that intersection of change and emotion in the workplace. And I want to deliver that to you today for free. Now, of course, this is a keynote message that clients pay me to deliver around the world, but it's yours today for free. All you got to do is click on the link below. I want to make sure you have the data, the research, and the insights to fuel your growth through even your greatest change challenges. I'm Cassandra Worthy, and until we meet again, keep growing and keep rocking.